welcome back to another Brush Up on EMS with Bob. We're going to be talking about abdominal anatomy and physiology. So let's figure out, why do we have the certain problems we do in our abdomen when our tummy hurts? When we say, oh, it doesn't feel right. So abdominal anatomy and physiology, the abdomen contains many organs. We're talking the liver, the pancreas, the stomach, the small, the large intestine, the appendix, the spleen, the gallbladder, the kidneys. We're talking a lot of organs in there. So when we have an abdominal emergency, it's really hard to determine what are we dealing with. So we've got to divide things into quadrants. We've got to figure out where that pain is. Is it referred pain? Is it visceral pain? Is it somatic pain? What kind of pain are we dealing with? And is this really an issue? Is this a major emergency, or is this something that we can take our time with? So a thorough patient assessment is going to be key. Specific diagnosis, it may be hard to do, but our treatment is going to be a little bit similar for all of these different conditions. So the abdomen is your region between your diaphragm and your pelvis, and it contains your digestive, your reproductive, your endocrine, and regulatory organs and organ systems that deal with those different functions. And the solid organs that we have in our abdomen are the spleen, liver, pancreas, and kidneys. Solid organs are highly vascular, and so if a solid organ is ruptured or has trauma done to it, we're going to have blood gushing out inside the abdomen, and we can fill up to about 1,500 to 2,000 liters before we start seeing any changes in the abdomen. Hollow organs are your stomach, your gallbladder, your duodenum, your large intestine, your small intestine, and your bladder. The hollow organs don't bleed as much, but the other problem that they bring is all of the material that they're holding inside get released inside the abdomen and start causing infections when they rupture. So we divide the abdomen into quadrants. We have the right upper quadrant, the left upper quadrant, the right lower quadrant, and the left lower quadrant. And then the epigastric region, which is where we're talking where our stomach is. Okay, above the gastric, above the bowels. And then the separation between our respiratory and our abdominal is the diaphragm. If we have a diaphragmatic emergency where we have a rupture in our diaphragm, we can have some of the abdominal organs coming up into the chest cavity. You have your peritoneum, that's that thin membrane lining the abdominal cavity and covering each of the organs. And then the parietal peritoneum is attached to the abdominal wall. Okay, the parietal goes around everything, and then the visceral covers all of the organs. So visceral pain is that organ pain. It's right here. This is visceral pain right here. Okay, somatic pain is I just don't feel good. Okay, it's kind of a not good feeling. And then referred pain is when you have like your right shoulder hurting and your gallbladder is inflamed. The gallbladder has a nerve going right up here, and it starts hurting the right shoulder, and that's called referred pain. That's a good sign that they have a gallbladder emergency. So most of the organs are enclosed in that parietal peritoneum. The kidneys, pancreas, part of the aorta lie in that retroperitoneal space behind the peritoneum, and the bladder and part of the rectum lie inferior to the peritoneum. The peritoneal and extraperitoneal spaces are your different separations where you have your organs placed. So that's kind of some basic breakdown on your anatomy and physiology of the organs where they're at. And then diving into what they do, your liver is works with the digestive system. It does filter our medication. It's one of the first pass areas that we filter medication. The spleen helps filter the blood along with the kidneys, but the kidneys are number one for filtering the blood. When the kidneys go out, people have to go do dialysis. And the stomach is going to break down all the contents. It's going to have the glucose being released into the cells after it breaks it down. And that glucose is going to get absorbed in the small intestine. The large intestine is going to absorb more nutrients and also excrete the waste products reaching down to the rectum. Appendix, there's really not a lot of what's known about the appendix, but it does get inflamed, and if it gets inflamed to the point that it causes emergencies. So those are some of the organs. The gallbladder is going to release bile for the stomach, for the breakdown of materials, but if the gallbladder gets inflamed, we can also have gallstones, and that can cause severe pain. The kidneys, again, getting kidney stones, that can cause severe pain for people in their retroperitoneal, the back. So that's some of the stuff on kind of a little bit on their functions, where they're located. Definitely do more research on all the organs, but here's just a rough breakdown for you guys. Stay tuned for part 2, talking about abdominal emergencies in each one of the sections.